My name is Andrew Wolfe. I'm a board-certified plastic surgeon in Denver, Colorado, focusing on cosmetic elective plastic surgery. And we spend a great deal of time and effort trying to optimize the patient experience in terms of the surgical result, but then also the patient experience during and after surgery. And that includes staying on top of the most recent additions to our pharmacology. And one of the medications that we've begun to use fairly frequently of late is called Exparel, which is essentially a long-lasting local anesthetic, and it's a medication that's been around for a very long time called bupivacaine. Very well known. It tends to last 6 to 8 hours, which may be great for short-term postoperative comfort if you inject it during the surgery, but most patients will start to experience pain very quickly. And so what Exparel is a very long-lasting form of that medication. The bupivacaine is stabilized with fat, and so the body metabolizes it very slowly over 2.5 to 3 days. And so what you have now is a medication that can be injected into any tissue area and provide very long-lasting comfort, typically past the point where somebody's going to feel that acute pain from surgery. And it's been shown to significantly reduce narcotic usage in postoperative patients, and that's one of the things that we are finding really can make a big difference. The more narcotics patients use, they deal with a whole host of other adverse effects from their narcotics. Obviously, constipation can be an issue. Overuse or underuse of the medications, refilling prescriptions can be very challenging now with new FDA regulations. And so if you can minimize the narcotic use, it's very, very helpful. We have found the most success in terms of difference between how patients experience surgery with tummy tucks. It is a surgery where the muscle is tightened significantly that can lead to postoperative discomfort. And so what we do is inject the Exparel throughout the entire field, but especially in the abdominal musculature, and it provides for a fairly seamless postoperative experience for patients. I've had a number of patients experience tummy tucks and never need narcotic medication, which is unheard of in the absence of a long-lasting local anesthetic like this. I find it much more effective than pain pumps, because with a pain pump, which is a small tube that sits in the surgical space, that local anesthetic is really limited to the immediate vicinity of the tube. With Exparel, you can infiltrate the entire surgical field. With the medication, you get a very, very broad area of relief, and it's worked great for us. It adds a bit to the cost of surgery. Many patients, especially those patients who don't do well with narcotic medication in terms of nausea and vomiting, that kind of thing, tend to do very, very nicely with the Exparel. It can also be applied to other surgery, breast augmentation surgery. It can be used to numb up the muscle. That can help with that immediate postoperative discomfort as well.